What is arthritis? Arthro comes from a Greek word that means joint, which is where two things come together to connect, and then itis, which means inflammation. So if we just take the word at face value, we get joint inflammation. The problem is arthritis is more of an umbrella category where there's lots of other things that fall underneath that. There's actually over 100 different types of arthritis. So I'm just going to cover some of the main ones and some characteristics that are consistent across the board. So first off, because the word is arthritis, that inflammation is in there, all the different types all have inflammation in common. Because of that inflammation inside the joint, which again is where two bones come together, so imagine your shoulder, your hip, your spine, because of that inflammation that's in there, we obviously get pain. We also get changes in the bone and the cartilage itself, because on the surface of the bone where the two bones touch, where they slide against each other, is supposed to be smooth and have cartilage there to make it so there's no friction. So we actually get bone and cartilage destruction, which means we also get range of motion issues and pain depending on the type that we're dealing with here. So that's what's consistent across the board. The most common type of arthritis is osteoarthritis. This is what we characteristically just refer to as old age or wear and tear. The thing though is there is a normal amount for how old are you, what type of activities do you do, but I've seen plenty of people that are in their 20s, 30s, 40s, that their x-rays or the way that their joints are now shaped, they look like they're 70, 80 years old, which is why you hear about people that have to have joint replacements at a very young age. Typically that comes from some sort of injury that they had, which is why the joint wore out faster than it should have, okay? So that's osteoarthritis. Now there's also rheumatoid and psoriatic are two also very common. They fall under inflammatory arthritis, where it's more of a genetic issue, it's an autoimmune disease, where your body actually, for whatever reason, it attacks itself, and so it wears that stuff out faster than it should because your immune system is haywire. So those are also very common types. What's really, really cool is that chiropractic care has been shown to either slow, if not outright arrest, the process of degeneration when it comes to the spine. So regardless of the type of arthritis, chiropractic care is going to, yes, improve symptoms, but also slow down that process of wear and tear that occurs because of that inflammation. So that's a little bit about what arthritis is and why chiropractic care is so effective in treating that condition.